The case study conceptualization for the Stein case. Symptoms is experience of nervous breakdown. He had lack of sleep, inner agitation. He has symptoms of stomach aches and diarrhea, frustration. He was keyed up most of the time, decreased ability to concentrate at work. He has normal symptoms after seeing an internist and gastroenterologist. Denies feelings of worthlessness or suicidal thoughts. Behaviors. Reported always been a worrier. His wife reported he tosses and turns in bed until the middle of the night, frequently urinates. His wife reported he yells at people, even at their 7-year-old daughter. He has always been driven and generally on the extroverted side. At night, he stares at the ceiling and worries about routine work issues. He calms himself down occasionally with a beer or two. He denies any alcohol-related problems. He has tried cocaine a couple times in his late 20s, but did not like the feelings of denies using any street drugs. He never had a problem asking women on dates and having them accept. Stressors. Being a worrier and lack of sleep oftentimes affects his life in a notable way. He was compelled to continue tradition to attend the same Northeastern Ivy League university. He has been apprehensive that his academic skills were not refined enough, although he was in the 95th percentile of his graduating class. Pressured when he was accepted to perform exceedingly well. Experienced tremendous anxiety and tension around exam time. When dating his wife, he recalled worrying for days about whether or not he picked the right car and went to the right restaurant for a date, flowers, or if his car would break down. His parents separated, and his investment banker company almost was close to bankruptcy. He worries about how he will support himself and his family. Length of issues. Past year onset experienced feelings of inner agitation, frustration, and oftentimes keyed up most of the time. 6 months symptoms of stomach upsets and diarrhea, decreased ability to concentrate at work. Past 6 to 8 months onset, his wife complained that her husband had gotten irritable and frequently yells at people, even at their 7-year-old daughter. 3 years before the current evaluation onset, Mr. Stein's parents separated and his investment banker company came close to bankruptcy. At night onset, he lays awake and stares at his ceiling and worries about routine work issues, his future supporting himself and his family if his company went bankruptcy. The DSM-5-TR diagnosis and diagnostic criteria. The client conceptualization. Mr. Stein has exhibited by the following symptoms. He reported having a nervous breakdown, lack of sleep, has inner agitation, frustrations keyed up most of the time, decreased concentration at work, denies feelings of worthlessness and suicidal thoughts. He is experiencing social problems with others. He yells at people, even his 7-year-old daughter. He is a worrier, but usually driven and generally on the extroverted side. He is struggling financially and has been close to bankruptcy. Mr. Stein has experienced medical problems such as stomach aches and diarrhea. He calms himself down by drinking occasionally 1 or 2 beers occasionally. He had an evaluation done 3 years ago. Diagnosis with F codes and specifiers and modifiers. F34.1 or comma 1, persistent depressive disorder with anxious distress and partial remission, late onset moderate. Client meets several criterions. Criterion A, example, meet a depressive moods for most of the day. Criterion B, presence while depressed 2 or more of the following: insomnia or hyposomnia, poor concentration, or difficulty making decisions. Criterion H, the symptoms cause clinically significant distress or impairment in social, occupational, or important areas of functioning. F41.1, general anxiety disorder. Client meets several criterions. Criterion A1, with excessive anxiety and worry occurring more days than not for at least 6 months. Criterion C, the anxiety and worry were associated with 3 or more of the following symptoms: restlessness or keyed up, difficulty concentrating, sleep disturbance. Criterion D, the anxiety, worry, or physical symptoms cause clinically significant distress or impairments in social, occupational, or the important areas of function. Other diagnoses to consider if there was sufficient information. F4325, adjustment disorders with mixed disturbance, emotions, and conduct. F45-9, unspecified somatic symptoms and related disorder. F32.89, alcohol-induced anxiety disorder with mild use disorder. Diagnostic features and risk factors. Diagnostic features will be based on the diagnosis of F34-1, persistent depressive disorder. Diagnostic features. The client reported that he experienced lack of sleep, keyed up most of the time, decreased ability to concentrate at work, and experienced a nervous breakdown. His behaviors has been yelling at people and his 7-year-old daughter. He lays in the bed in the middle of the night and worries about routine work issues. He tosses and turns until the middle of the night. He has complained about stomach aches and diarrhea and urinates frequently. He drinks occasionally a beer or two to calm himself down. Based on diagnosis of 41-1, generalized anxiety disorder, diagnostic features. The client reported being keyed up, difficulty concentrating, and sleep disturbances. His behaviors are he is ruminating about his work duties and not being able to finally provide for his family if he goes bankrupt. He is bothered by stomach aches and diarrhea. He is deflecting on his past when he was younger, trying to fulfill the expectation of his parents and family traditions. Risk factors. Client has experienced lack of sleep, frustration, and inner agitation keyed up most of the time, which can be associated with his occupation, but now is affecting his home life with his misconduct toward his 7-year-old daughter, which can be temperamental and environmental factors. Based on his history, he did not report his family handling stress when he was a child. However, he addressed being compelled to follow the family transition and pressure to perform exceedingly well. He denies feelings of worthlessness or suicide thoughts. Klein has not addressed if excessive worrying was part of his cultural background. His behaviors are associated with temperamental and environmental factors. Other diagnoses to consider if there were more symptoms and sufficient information. F4325, adjustment disorders with mixed disturbance, emotions, and conduct. F45-9, unspecified somatic symptoms and related disorder. F3289, alcohol-induced anxiety disorder with mild use disorder. I would use cognitive therapy as a modality to help him process his emotions and feelings about his finances and obtaining attainable goals for him and his family. Communication styles when under stress and anxiety as a parent. Positive self-talk and deep breathing techniques to help decrease his stress and help him relax. Journaling when he can't go to sleep on his feelings to determine if he's experiencing struggles with his past or present issues. In addition, ways to utilize self-care and exercise to decrease anxiety and ways to recognize anxiety and depression symptoms in order to alleviate them.